I know. What
You didn't get leave. What am I here? Yeah, good point. Do you want to come in, Lindsay? Lindsay, do you want to come? Well, it's Christmas time, and one of the things I like to do at Christmas is come and thank the staff and volunteers here at the Queensland Children's Hospital. They all do such an incredible job of making this a very special place, especially at Christmas time when it can be very difficult for young people and families experiencing injury and illness at what should be a really happy time. But the staff and volunteers here at the Children's Hospital always make sure that they can make it as good and as special as they possibly can. So to all Queenslanders, I say spare a thought for all of those essential workers who will work through this festive season to take care of us and to keep us safe. Not just, of course, the doctors and nurses and health professionals, but all of the other essential support staff that keep our hospitals operating. You know, the cleaners, the security, the people who make the food, make the meals. They all do such an incredible job, and I think the last few years we've really seen how important they are. Also spare a thought for all of the other essential workers, our emergency services, and especially this Christmas, I think, our police. They are, of course, still grieving. Those families are still grieving. To anyone at home, any Queenslanders wondering how they can help this Christmas, well, I'd urge you to consider making a donation to the Children's Hospital Foundation. The foundation does a fantastic job of supporting research into child illness and child health, as well as all of those fantastic activities and volunteer activities that, as I say, make the Children's Hospital such an incredibly special place. Donations are tax deductible, and I'm sure Lindsay from the Children's Hospital Foundation can tell you a bit more about how you can make a donation and also what those funds go towards.
Thank you. Thank you very much. I'd also like to acknowledge the remarkable contribution of the volunteers who make all of this work possible. At the Foundation, we believe that no child deserves to be spending Christmas in hospital, but what we do is we work closely with our community and our partners and our remarkable volunteers to make sure that the time they do have to spend here is as special and magical as possible. At the Foundation, we just want kids to be kids. And we work with this remarkable hospital to do what we can to create special memories and special moments. If you'd like to support the work we do at the Foundation, please consider making a donation at childrens.org.au. You'll be funding all of the patient and family support that we provide to children, young people, and importantly their families, the parents, the carers, the siblings who are doing it tough this Christmas. You'll be funding life-saving research, and you'll be helping us purchase some of the leading equipment possible to make these children have the best possible outcomes possible. Thank you so much, Queensland, for your support. Thank you for your continued generosity, and I hope you all have a wonderful festive period.
It's Christmas. Would you encourage Queenslanders, if they can't volunteer here, but to volunteer elsewhere and to give their time?
Yeah, of course. Everywhere I go in Queensland, I see the incredible contribution that Queenslanders make to their community, and Christmas is a special time where there's more of those kinds of opportunities. And so I've just been with the volunteers packing stockings with gifts for young people, singing carols, brightening up the foyer. There's just so many ways you can contribute to make Queensland the great community that it is.
Just on COVID matters, Dr. John Gerard encouraging people to wear masks. Do you think we need to increase mask usage from what we've seen around the community? What are your thoughts there?
So I understand that the Chief Health Officer expects the current wave to peak roughly next week. We have 14,825 active cases that we know of right now here in Queensland, including 1,733 new cases reported today and tragically 11 new deaths reported today. Those precautions that we can take can keep our loved ones safe and also ease the pressure on our hospitals, making the job of our health workers even easier. The other thing we can do is remember that emergency departments are for emergencies. Our staff here are working just as hard as they can to take care of everybody who presents to emergency or who arrives in an ambulance. But one of the things we can do is make sure that if we can get treatment elsewhere in a primary healthcare setting, at a pharmacy or at a general practitioner, that can ease some of that pressure on our emergency departments. Remember that our hospital workforce is also affected by COVID. That's having an impact on rosters and staff being away. So while our healthcare staff will continue to do everything they can to keep us safe, we can do all of the things that we've been hearing about the last few years. We can keep our hands clean, we can socially distance, particularly from those who might be vulnerable in, for example, an aged care setting, and wear masks where we're asked to or where we can't socially distance.
No enforcement of masks at this point?
No, we're still at amber level in our COVID response, and so that's in recognition of the current level of COVID in the community, and the fact that now that we have been vaccinated, we continue to manage COVID in the community. And the message really is that if you're around vulnerable people this Christmas, well, first of all, if you have symptoms, you probably shouldn't be. Reflect on that, but also take those other precautions. Keep your hands clean. Wear a mask if you'd like to.
Aged care is really copping the brunt of it. Last week we were reporting there's like 172 facilities with outbreaks. That's quite a lot.
That's right. We've always known that the aged care setting was the most dangerous for COVID spreading. That that the elderly are the most vulnerable to the disease, and in that setting, it can be very hard to control. And so, I've seen the comments today. I think it makes sense that people should follow the directions at their aged care centre if they are visiting relatives. I don't think we need to be alarmed. This is what we've expected to happen, these ongoing waves washing through the community. Our hospitals and our health workforce, they're well equipped to deal with them. They've dealt with several of them now. But the thing that we can do is get vaccinated and take those other healthcare precautions.
And just one more. What about the large number of health staff who are needing to isolate?
Through each of these waves, we've experienced the high level of furloughing of staff as they seek to keep themselves, their colleagues and their patients safe. And of course, we encourage them to take those precautions very seriously. And our hospitals are well practiced at how to roster around and manage the workload when we have those peaks of staff on furlough.
Do you have the numbers for how many are furloughed right now?
I don't know, but we can get them for you, Josh.
Great.
Very good.